Are your thyroid meds actually making you feel awesome again? Or are you still battling instant fatigue, mega brain fog, and weight that refuses to disappear, even when your lab results scream normal? Maybe you just got hit with a hypothyroidism diagnosis and you are thinking, which way do I go? If this is you, you are not alone. Tons of people with hypothyroidism are not happy with their current treatment and are hunting for something bigger. Today, we are not just scratching the surface of symptom relief. We are diving deep into two totally different ways to heal, the ancient secrets of Ayurveda and the data-packed power of Western medicine. We are going to explore how each one crushes hypothyroidism, giving you the knowledge bombs you need to make galaxy brain choices for your health. Because when it comes to your well-being, you should be driving the hypercar. Alright, let's kick things off with what most of us know, Western medicine, sometimes called allopathic or conventional medicine. Its plan for hypothyroidism is super straightforward and built on rocks of evidence. The main goal? Find what's gone and replace it. In hypothyroidism, that gone something is thyroid hormone. Your thyroid gland just isn't pumping out enough for your body to run like a well-oiled machine. How do doctors figure this out? It's mainly through crazy numbers from blood tests. They stare super closely at key things, especially thyroid-stimulating hormone or TSH. Think of it like this: if your thyroid hormone levels are tanking, your pituitary gland shouts louder by unleashing more TSH to try and force your thyroid to work harder. So, a high TSH level usually means your thyroid is slacking. Doctors also check your thyroxine, T4, levels. That's the main hormone your thyroid makes, and sometimes triiodothyronine, T3, which is the super active form of the hormone. These tests give a high-speed snapshot of what your thyroid is doing and how your body's reacting. Once hypothyroidism is confirmed, the standard treatment is usually thyroid hormone replacement therapy. The MVP medication is levothyroxine, which is a synthetic version of T4. You pop this pill every single day, and the mission is to get your body's T4 levels back to boss level. Your body should then flip that T4 into T3 in your tissues as needed, which, bam, helps normalize your TSH levels and kick those frustrating symptoms to the curb. The upsides to this are huge. Levothyroxine is insanely good at fixing the hormone shortage. For so many people, this means feeling way better or less fatigue, not feeling like an ice block 24/7, and better weight control. It's a treatment that's been studied for decades, with mountains of data backing its use and crystal clear rules on dosing and how to watch it. Regular blood tests help doctors fine-tune the dosage to make sure your hormone levels stay in the perfect zone. This is uber important for dodging the problems that can come with untreated hypothyroidism, like heart nightmares or just feeling completely wiped out. But the Western medicine approach isn't a perfect miracle for everyone. For many, taking levothyroxine is a lifelong mission, research says. While the medication itself is usually no big deal, finding that perfect dose can sometimes feel like an endurance challenge, needing tons of patience and frequent checkups, especially when you are just starting out. One massive frustration for some people is that even when their TSH and T4 levels look normal on paper, they still deal with symptoms like tiredness, brain fog, or mood swings that are a total downer. Studies and patient feedback have shown this dissatisfaction, with some people feeling like their quality of life just isn't fully back, even though they're taking their medication like champs. This has sparked huge debates in the medical world about what else might be going on beyond just TSH numbers. Things like how well individuals convert T4 to T3, whether adding T3 medication might help in some cases, though this is still a hot debate and not common practice, or even if other secret issues are mimicking hypothyroid symptoms. Some research also screams about how important a good doctor-patient relationship is, and how feeling informed and supported can really change how happy patients are with their treatment. Also, while levothyroxine replaces the hormone that's missing, it doesn't usually fix the original reason why the thyroid went on strike in the first place. This is especially true if it's an autoimmune condition like Hashimoto's thyroiditis, which is the #1 cause of hypothyroidism in places where people get enough iodine. With Hashimoto's, your immune system mistakenly attacks your thyroid gland, slowly making it weaker at producing hormones. Conventional treatment mostly focuses on replacing those hormones rather than directly battling the autoimmune attack itself, though new research is always digging into this. Now, let's flip the script and journey into a system of medicine that's been around for thousands of years, Ayurveda. Born in India, Ayurveda looks at health and illness, including hypothyroidism, through a completely different, mind-bending lens. It's a holistic philosophy, meaning it sees your body, mind, and spirit as all connected, like a super team. Instead of just targeting a missing hormone, Ayurveda tries to understand and fix the deeper imbalances that might have thrown the thyroid off the rails in the first place. In Ayurvedic language, hypothyroidism is often seen as a sign that your doshas are going wild, specifically, that Kapha and Vata doshas are turbocharged. Kapha dosha, linked to earth and water elements, rules your body's structure and lubrication. Too much Kapha can lead to feelings of heaviness, coldness, and sluggishness. Sound familiar? These are a lot like hypothyroid symptoms such as weight gain, fatigue, and a super slow metabolism. Vata dosha, connected to air and space, is all about movement and communication. When Vata is unbalanced, it can cause problems like dryness, think dry skin or constipation, and mess with your metabolic processes. Ayurveda also often points to Agnimandya, or a weak metabolic fire, and the buildup of ama, or metabolic toxins, as key villains in thyroid issues. These toxins can clog your body's channels, making an already slow metabolism even slower. The way Ayurveda diagnoses is hyper-personal. An Ayurvedic practitioner might glance at your blood tests, but their assessment goes way deeper. They use techniques like Nadi Pariksha, pulse diagnosis. How cool is that? Closely observe your physical features, like your tongue, eyes, and skin, and ask mega-detailed questions about your diet, lifestyle, digestion, energy levels, and how you are feeling emotionally. This helps them understand your unique natural constitution, Prakriti, and your current imbalances, Vikriti. This intense evaluation helps them create a treatment plan that's custom-built for you, not some generic, boring approach. Ayurvedic treatments for hypothyroidism are designed to do a few epic things: calm down those ragging doshas, get your digestive fire, Agni, burning brighter than the sun, clear out toxins, ama, and nourish and rejuvenate your thyroid gland and your whole system. Some common strategies include herbal remedies. Ayurveda has an unbelievable arsenal of herbs. For thyroid support, some of the legends are Ashwagandha, Vidania somnifera. This is a famous adaptogen, meaning it helps your body crush stress better. Some studies suggest it might help regulate thyroid hormones, possibly by supporting the T4 to T3 conversion and reducing how stress attacks thyroid function. Small clinical trials have actually shown it can improve T3, T4 and TSH levels in people with subclinical hypothyroidism. This is huge. Guggulu, Commiphora mucul. Known for its anti-inflammatory and detoxifying superpowers, Guggulu is thought to stimulate thyroid function and boost metabolism. Kanchnar Guggulu. This is a traditional Ayurvedic formula specifically used for glandular problems, including thyroid issues. It combines Kanchnar, Bohemia variegata, bark with Guggulu and other herbs to help with lymphatic drainage and reduce swelling. They're even testing it against levothyroxine. Trifla. A mix of 3 fruits, Amlaki, Bibhitki, Haritki. Trifla is a big deal in Ayurvedic detox. It helps with healthy digestion and elimination, which is seen as super duper important for getting rid of ama and, indirectly, helping thyroid function. As per research, other herbs like Brahmi, Shilajit, and Jatamasi might also be used for their metabolic, adaptogenic, and nerve-supporting payloads. Some newer research is also exploring herbs like Shigru, Moringa oleifera. Panchkarma therapies. These are Ayurveda's signature detox and rejuvenation treatments. Get ready. Depending on your specific imbalances, you might be recommended therapies like Virechana, therapeutic purgation, Basti, medicated enemas, or Abhyanga, therapeutic oil massage. The goal here is to deeply cleanse your body of ama, bring your doshas back into balance, and improve how all your tissues, including your thyroid gland, are working. Diet and lifestyle modifications. Ayurveda really hammers home that diet, ahar, and lifestyle, vihar, are the foundations of good health. For hypothyroidism, dietary advice usually focuses on eating foods that are warm, light, and easy to digest. No boring food. Avoiding foods that are heavy, oily, cold, or processed. as these can drown your Agni and increase Kapha. Adding warming spices like ginger, cinnamon, black pepper, and turmeric to help stoke your metabolism. Making sure you get enough iodine-rich foods if that's a worry, but also being careful not to go overboard. Lifestyle advice includes things like having regular routines for sleeping and eating, getting regular, appropriate exercise like yoga and pranayam, breathing exercises to boost metabolism, reduce stress, and improve energy flow. Recent studies have proven that long-term exercise can improve thyroid function by lowering TSH and increasing T4 levels. Managing stress through meditation and getting enough sleep are also seen as absolutely critical. The potential huge win of the Ayurvedic approach is that it's holistic and focuses on getting to the root of the imbalance. If you are still having persistent symptoms even though your lab tests are normal, or if you are looking to improve broader aspects of your well-being like stress, digestion, and overall vitality alongside thyroid support, then Ayurveda's holistic toolkit offers some valuable options. And this is a big one. Seek guidance from qualified practitioners in both fields. Talk to an endocrinologist or a knowledgeable primary care physician to understand the Western medical take on your condition and treatment options. If you are curious about Ayurveda, find a well-qualified and experienced Ayurvedic practitioner. Be open and honest with all your healthcare providers about any treatments or supplements you are considering or using. This open communication is vital for safe and effective care, especially if you are thinking about an integrative approach to avoid any bad interactions. The journey to optimal thyroid health is unique for every single person. If this exploration of Ayurveda and Western medicine for thyroid health absolutely blew your mind, please smash that like button. It really helps our channel. We'd love to hear from you. Share your experiences, questions, or insights about managing hypothyroidism in the comments below. And if you haven't already, please subscribe and hit that notification bell so you don't miss out on more videos designed to empower your health journey. Thanks for watching, and we wish you well on your path to vibrant health. Go be awesome!